Namaste. I'm Captain Usha Banerjee, the Group Director Nursing at Apollo Hospitals Group, and also a founder member of ANEI. This pandemic that is raging across the world has taught us some great lessons of humility and humanity. It is urging us to transform into better human beings and care for our environment, lives, and livelihoods around us. This has definitely put the nurses and the nursing profession into a spotlight. And I'm saying this with conviction that it is time to celebrate this limelight. I'm very, very happy and delighted to see that very young nurses have stepped out with physical endurance, mental agility, and a fearless attitude to take care of patients. And it's such an overwhelming moment for us to see that they have volunteered to take care of patients. But at the same time, I think it's equally important for us to take care of the caregivers. And I'm also seeing that organizations have stepped up and above in order to take care of the healthcare workers, especially the nurses, because they understand that nurses work in absolute close physical proximity for very long hours with the patients and ensure a holistic care that they provide to the patients. It is time for us to understand and be a little more empathetic and tolerant to these nurses. It's not usual care time. Nurses work very, very long hours in those PPEs without a bio break or meeting their other biological needs. So, some amount of empathy, tolerance, and patience from colleagues and other caregivers, and also from patients and families, is expected as a need of the hour. And I'm very, very happy to say that nurses have gone beyond their call of duty in order to celebrate the miracle and birth of a child, or say a silent prayer when somebody is dying, or even maybe shed a small tear when somebody's body is being packed into those poly bags without a family member around. It's a very, very overwhelming and a very difficult moment, both emotionally, physically, and socially. I urge everyone to understand that the need of the hour is epidemic literacy, individual citizenship, social responsibility, and a care and empathy towards each other, be it a patient, be it a nurse, be it a doctor, or any other healthcare worker who is now surrounded with this challenge of dealing with the pandemic. And I'm sure all the nurses together today in this country, especially in India today, will rise to this occasion and make it a safer nation and a better society. And we will come back with a great victorious moment that we will be proud of. And the names of many, many people would be etched in history. It's also time for us to take a moment and say a silent prayer for all those who have laid their lives down in the call of duty. And my heart goes out to the nurses and their families. I just have one word to say: thank you. May all of us stay safe and blessed always.